During the first trimester of pregnancy, there are several important precautions that expectant mothers should take to ensure the health and safety of both themselves and their developing baby. The first trimester is a critical time in fetal development, as major organs and systems are forming, making it crucial for pregnant women to be mindful of their lifestyle choices and habits. One of the most important precautions during the first trimester is to avoid harmful substances such as alcohol, tobacco, and recreational drugs. These substances can have a detrimental impact on the developing fetus, leading to a higher risk of birth defects, low birth weight, and other complications. It is essential for pregnant women to abstain from these substances entirely to protect the health of their baby. In addition to avoiding harmful substances, pregnant women should also be cautious about their caffeine intake during the first trimester. While moderate caffeine consumption is generally considered safe, excessive amounts of caffeine can increase the risk of miscarriage and other complications. It is recommended that pregnant women limit their caffeine intake to no more than 200 milligrams per day, which is equivalent to about 1 12-ounce cup of coffee. Another important precaution during the first trimester is to be mindful of food safety. Pregnant women are at a higher risk of foodborne illnesses, which can be harmful to both the mother and the baby. It is important to avoid raw or undercooked meats, seafood, and eggs, as well as unpasteurized dairy products. Pregnant women should also wash fruits and vegetables thoroughly and practice proper food handling and storage techniques to reduce the risk of foodborne illnesses. In addition to food safety, pregnant women should also be cautious about their exposure to environmental toxins during the first trimester. This includes avoiding exposure to chemicals such as pesticides, cleaning products, and lead, which can be harmful to the developing fetus. Pregnant women should also be cautious about their exposure to radiation, including X-rays and certain medical procedures, as well as limit their use of certain medications that may be harmful during pregnancy. It is also important for pregnant women to take precautions to prevent infections during the first trimester. Certain infections, such as rubella, cytomegalovirus, and toxoplasmosis, can be harmful to the developing fetus. Pregnant women should take steps to reduce their risk of exposure to these infections, such as practicing good hygiene, avoiding contact with individuals who are sick, and getting vaccinated against certain infections if necessary. In addition to these precautions, pregnant women should also be mindful of their physical activity during the first trimester. While regular exercise is important for overall health and well-being, pregnant women should avoid high-impact activities and contact sports that may pose a risk to the developing fetus. It is recommended that pregnant women engage in low-impact exercises such as walking, swimming, and prenatal yoga to stay active and healthy during the first trimester. Finally, pregnant women should also be cautious about their prenatal care during the first trimester. It is important for expectant mothers to schedule regular prenatal appointments with their healthcare provider to monitor the health and development of the baby. Prenatal care may include routine screenings, ultrasounds, and blood tests to ensure that both the mother and the baby are healthy throughout the pregnancy. In conclusion, the first trimester of pregnancy is a critical time in fetal development, and it is important for expectant mothers to take precautions to protect the health and safety of both themselves and their baby. By avoiding harmful substances, practicing food safety, reducing exposure to environmental toxins, preventing infections, staying active, and seeking regular prenatal care, pregnant women can help ensure a healthy pregnancy and a positive outcome for their baby. It is essential for pregnant women to be mindful of these precautions and make informed choices to support the health and well-being of themselves and their developing baby during the first trimester of pregnancy.